have access to for our new parent company. But, we've been in business doing short-term medical, ancillary products, you name it, for at least since 1940. So, again, to say that we are a new company would be a bit of an understatement. We've definitely been doing it for quite some time. We've got solid products, solid rates, great offerings, and if anything, we're just expanding upon that and adding a more well-recognized brand name to that with AllState. Since we got acquired back in 2021, we worked really, really hard with AllState to help them understand kind of our desires, our drive, where our focus is, and where we're hoping to take our health products, of course, moving forward. And after helping them kind of understand all that, they took all of our information and did some market research and some studies, and out of that really came some really good confidence, at least from the AllState side. And so they kind of said, well, what do we need to make this the next big thing? And of course, we said, well, we'd like to have your brand. So if you can bless us with the AllState name, of course, we'd love to have that, and it would definitely help. And then a little bit of money, sure. Having some money we can play around to help with revising some things, again, just makes it stronger and just allows us to do a little bit more with our product to make it that much better. So as you'll see here today, I'll be talking a little bit about that, but it's really important to understand I guess the history of us, simply because, with Medicare supplement programs specifically, they're looking to make sure that there is confidence and stability within those programs. Sure, looking for those plans that have the lowest rates in most cases, but, additionally, I think in these days specifically, it's not as much of what's the lowest rate and that's the plan I want. It's a kind of a combination of, okay, what has the lowest rate and how stable of a company are they? And that's just simply because I think people have kind of learned and grown accustomed to the fact that, unfortunately, with MedSups, the rates do go up on an annual basis. At least in most cases, they do. And so, knowing that the company's been around for a while, that they've been doing this for a while, and that they are a stable company that doesn't take on much risk, really this kind of helps further support that their decision and that they're making the right decision, and they are making, of course, the right company to have their insurance through. And so with all that, again, even though AllState is a new name to our product, it is not a new product by any means. We've had our Medicare supplement product around since about 2018. And since then, we've just been working as hard and diligent as we can to make it as, again, as appealing in the market as we can. We introduced our multi-discount Medicare supplement plans last year, and just continue to roll that out into more and more states as time goes on. So we'll be talking a lot about the multi-discount Medicare supplement plan here today, as well as showing you some other discounts, as well as some other products that we have available. And then lastly, we'll round out with showing you the quoting portal. So that way, obviously it's important to know where to go to find the information, how you can run quotes, and just how easy our portal is to navigate. So that way you can be as efficient and effective with your clients as possible. So with that being said, let's go ahead and jump over into the next side here. So with our, of course, our AllState Medicare Supplement Program, who doesn't recognize AllState brand, right? You're in good hands with AllState. I think most people, recognize that. At least the market research that we did and, the focus groups, there's something with the AllState name that just resonates well with the seniors. And they definitely felt the warmth and comfort that AllState and the name brings just by saying it. So again, now that we have the AllState brand on there, I'm sure that will definitely help you guys overcome a couple of hurdles when you're positioning our products with your clients. Now, as far as the company is concerned, we like to think of ourselves as being innovative. I'm sure most companies are likely going to say something to the effect as well. But we literally did change the Medicare supplement market with our multi-discount Medicare supplement plans. These options give clients up to 25% off in stackable discounts, okay? These are stackable again. So, it's basically just a matter of asking them if they maybe live with somebody that's 50 years of age or older, if they're willing or in a position to pay their premium annually. Again, there's a couple of things, but they're just yes or no questions. And again, if they answer yes to those questions and are willing to go through that, then of course we will give them those discounts. So again, they are stackable. We'll get to those in just a moment here and show you just how those pan out. As well as, additional discounts as well. I'm sure, on the, car insurance side, you hear a lot of bundling. So, hey, if you have your car insurance and your homeowner's insurance, hey, we'll give you some discounts when you have both of those product lines with us. Similarly to that, if somebody were to buy our Medicare supplement plan, as well as buying our dental plan, all in the same enrollment experience, we'll give them a 10% discount off the dental plan for bundling that together. And then they can also get an additional 10% savings off of our dental plan if they haven't had any major dental work in the past 12 months. So again, just additional ways to be creative to get our clients great benefits for as low as we can possibly offer it in the market. Furthermore, you see on here Insta Decision e-app as well as an Instant ID card. And this was something that was really, truly near and dear to my heart. Just as, again, being an agent in the field and various roles and capacities over the years, submitting an application and then, of course, having to follow up on that application a week later, only to maybe, sometimes only have to follow up again in another week, right? Wasn't very efficient. It not only made multiple points of contact from that point forward, you're reaching out to the insurance company, you're reaching out to your applicant to give them an update. Again, all of that, is just time being spent. That's time that you're not spending on new opportunities. Furthermore, it also kind of leaves the applicant feeling a little unsure of where they kind of sit, right? If they're waiting, that sometimes bodes insecurity. And so they start questioning, did I make the right choice? Am I doing the right thing? And with that, unfortunately, in most cases, when seniors start questioning what's going on and what they did, they usually pick up the phone and start making all kinds of calls. Next thing you know, they have no idea where they called or who they're talking to. And next thing you know, that person, could just as easily sell them something else. And now they aren't in with